Ready to learn about pain and how to get rid of it? Hi, I'm Dr. Regina, and I am a board certified, double board certified psychiatrist, as well as a lifestyle medicine provider. So today I get to blend the two of those things. I don't always get to do that, but I'm excited about it today. So we're talking about the mind, mood, hormones, and how chronic pain is involved in all of that. So we're going to try to stick with two hormones today. So basically, or two pathways, let's talk about this. Your brain, giant bundle of nerves. Every nerve in the rest of your body that carries pain, temperature, um, that is involved in the reflexes starts at the level of the brain, comes down the brainstem, and then branches out. The two hormones that I want you to think about that are going up and down your spine, there are two that are incredibly important. One is actually called substance P, and I want you to think P for pain. The nerve tracts that control pain and temperature are in the dorsal lateral part of the brain. I'm sorry, the nervous system. So when you think about your spinal cord, in the back of the spinal cord, that is where pain and temperature run along. For my neurology folks, my neurology students, you all know exactly what I'm talking about. The thing that is important is this is how it's incredibly important for both pain as well as mood. And I love being able to show a nice little triad. I do not have my dry erase board with me, but let me tell you about this little triad here. At the top of it, I want you to imagine if there's a triad, a little triangle right here at the top. This is where pain is felt. But remember, I told you that it was along the same column as temperature, which is why when you apply ice or heat for some levels of pain directly, like let's say I have neck pain right here, it will dull the pain, right? It's kind of, I don't want to say eliminating substance P, but it's kind of toning it down. And your body doesn't really, it's not that it's not sending pain signals, but if your body is focusing more on the temperature that's being sent, it doesn't have enough time to focus as much energy on that pain symptom or that pain signal. That's why ice and heat can help you when you're experiencing pain. But let's say ice and heat aren't helping and you're still experiencing a lot of pain. Eventually, that can connect over to your mood. So let's say my hand is the mood area right now. So if I feel more pain, usually my mood gets a little bit worse. I might be anxious, not knowing where the pain is coming from. I might feel irritable or frustrated if the pain lasts a long time. I might also start eventually getting depressed if the pain just never goes away. There's another little point over here in my little triangle that's function. So if I'm in a lot of pain and I'm not functioning as well as I normally have, I'm not doing the things I normally do, maybe I'm declining going out to hike or run or do things that I normally like to do, or I'm declining social activities because of the pain, that little triad goes multiple different ways. If I'm in pain, I might restrict my activity. I don't do the things that I normally like to do. And guess what that does to my social life and my mood? Goes down. But what unfortunately can happen is if my mood goes down, I don't feel as good as I normally do, I actually can experience pain more. Remember that ice heat scenario? Imagine the opposite of that. Imagine that I'm experiencing pain more if my mood is worse and my function is worse. So that little triad, I have to kind of break the cycle somewhere. This is where advanced treatments come in. This is where if a person has something like TMS, transcranial magnetic stimulation, that can be incredibly helpful because it actually can stop the triad in multiple places. So I want you to imagine this triangle, and I'm stopping the triad here, I'm stopping it here, and I'm stopping it down here. So first one place I want you to think about is the connection between the pain and the mood. If I'm already feeling really down, guess what? Dopamine is one of those hormones that actually makes you feel better. Well, what if I'm not getting as much dopamine? Or what if I'm not getting as much of other pleasure hormones like endorphins? If I'm experiencing more pain, those symptoms actually can go down. But TMS can act like an outside of the body endorphin, right? You have endogenous endorphins, but also exogenous endorphins, the out of. the body ones. So the magnetic fields that are stimulated by TMS actually releases pain relieving chemicals like endorphins that calms the pain down. Very similar to that ice heat scenario that I gave you, but like 10 times over, right? Because you can't apply heat all the time. That could actually cause damage. You can't apply the ice all the time. That can cause damage. But if you've been tracking with me for a while, you've heard me talk about TMS and the fact that it can start stimulating nerve growth. That's neurogenesis. It can also stimulate nerve plasticity, neuroplasticity. And so your brain starts learning, wait, I can self-regulate in terms of releasing some of these endorphins kind of on my own. The nervous system can almost reboot how the brain interprets pain, right? And all of this elegant design that we're talking about, which I love the idea of creation, all of this works together, that rewiring that I talked about. So that's one way in terms of the mood, in terms of the endorphins and dopamine release. But what about the functional portion of it? Well, depending on what we're using to stimulate in terms of the TMS, whether we're trying to stimulate directly at the source of where you might be experiencing pain, like the shoulder for rotator cuff, or the neck because of a pinched nerve, or the back because of problems with the back, or plantar fasciitis because of the feet. If we're going directly to some of those areas, if we are placing the magnetic pulse there and we're starting to target there, you can get dual action. You're not only getting pain relief of chemicals, but you're also having that own little reboot or rewiring session, right? So that's a phenomenal thing that can happen with TMS. So that's kind of how it works. Now, here's the finesse. And this is kind of like TMS for chronic pain 102. So I just gave you 101. All right, very truncated version of 101. The 102 is, well, where do I place the device? There's actually two rules of thought. Now, obviously, TMS is used off-label for chronic pain management, and so that means usually insurance is not going to cover it. But again, the data is already there. You're already seeing some phenomenal articles that are talking about this, and that's why it's used a lot. That's why we use TMS for chronic pain a whole lot. But how we use it, everyone has a little different spin on it, and we in our clinic actually use both ways. One way is to target the same way that you would target for any other condition that we use TMS for depression, for OCD, for autism, for PTSD, start at the level of the brain. In my opinion, if I'm going to the source of the majority of the nerves in the body that are then extending to every other nerve in the body, it needs to be a big reason, meaning global pain. I'm trying to stimulate the brain to kind of reset and reboot the way the brain interprets pain in the entire body. So this is for people with chronic pain all over. This is for a person that has fibromyalgia. This is for a person that's got multiple pain areas and we think that they're connected in some way, right? So a person that might have a debilitating pain, chronic pain syndrome of some sort, where they're having pain that includes headaches, and they're also having muscle aches, and they're also having pain all throughout their body for a variety of different reasons. We don't specifically use it for something like sickle cell crisis because there's another reason for why they're having that, right? That's the sickling of the blood. But it's similar in theory, and the fact that it is a global, whole body source of pain. That's where I'm targeting the brain. And that's where I'm using things like the dorsolateral prefrontal cortex or the temporal parietal, where I'm trying to focus on retraining the brain globally to reinterpret pain and reduce the overall pain intensity and pain signal that the body sends out to multiple areas in the body. Second area is to directly target. So again, remember I said someone may have a rotator cuff injury, right? This is where we're using individual areas. If a person is preparing for surgery, still having a lot of pain, and they want to reduce the pain to be able to be ready for the surgery. So let's say the surgery is something that we think is going to correct the pain, rotator cuff surgery. But then I tell you, well, let's not use rotator cuff. Let's use knee surgery because that's an actual one that we've done. Let's use knee surgery. Let's say we have a person who is overweight, maybe morbidly obese. And because of the weight, the combination of weight and the pressure on the knees, they now have significant knee problem and knee pain. But then the doctor says, well, I want to do surgery on you, but we've got to do a pre-surgical evaluation and make sure everything is okay. Your heart, your lung exam is okay. All your labs look good. And your weight is in a good place that I can operate on you and not have you at increased risk that you're not going to wake up from the anesthesia, which is one of the most dangerous parts of any surgery. If a person is having complete anesthesia, right? We're not talking about a local injection or something, but we're talking about that. I got to put you to sleep so I can go and break or re-break a part of your body, cut into you to do what I need to do. So for that, I've got a patient has a need for knee surgery because of significant knee problems, and they're having lots of pain. But now they've been told, well, you've got to lose a certain amount of weight before you can have the surgery. And you've got to have a certain amount of physical fitness before you can have the surgery. So I'm asking you to lose weight and I'm asking you to increase your physical activity, but you're already in pain. Do you see the problem with that? That's where TMS can come in. That's where local injection and some other things can come in, because it allows you to reduce the pain level so the person can function. Remember the triad over here. The person can improve their function so that they can be prepared for the surgery. So I've recommended TMS, even if we can't do it personally. If I do an evaluation and I talk to you, and I can obviously make sure that TMS is a good option for you from a safety perspective, no seizure history, or some of these other concerns that we might have with TMS. You don't have metal in the body above the chest area, right? We do all that evaluation. We make sure that you're safe for the surgery from that perspective, and then we also say, well, wait a minute. Can we directly treat you for this TMS? So remember what I said about global pain? Even if you have significant seizure history, even if you've got metal from the chest up, if I am directly targeting your knee, why do I care? I'm not saying I don't care, but why do I care as much about the fact that, you may have remote seizure history, or you may have metal, above the chest? I'm using the TMS device to send magnetic pulses to your knee. Do you see why this is powerful? This is incredibly powerful because people that you typically hadn't thought about for TMS, because you were always trying to do a centrally targeted, or locate centrally, meaning the brain, central nervous system, a centrally targeted impulse. Well, now I'm trying to use this for your knee to reduce your pain so that you can go and function, so that you can move and possibly lose weight in preparation for that knee surgery. Or I am doing it for the plantar fasciitis on your foot. So I'm reducing the amount of pain that you're having so that you can walk and hike and do other things, right? This is for the weekend warrior. This is for the person that is going for a hike. This is a person that's already planned to do some trip. You're climbing somewhere, you're Mount Kilimanjaro or wherever, and you've been told that you really do kind of need surgery for a particular area so that you will have complete pain relief. But you've got this trip planned, or you've got this family outing that you want to go on, and you want some, at least moderate, pain relief. And pills aren't cutting it, and injections not cutting it, or it's too soon for an injection. This is the second story where we get pulled in. Persons have multiple injections, and it's to the point where their lower back is really paining them. They can't function. They can't do a lot, but it's too soon for their next injection, right? That lidocaine or that anesthetic plus whatever steroid they're being given has worn off before the next month. Well, what are you going to do? This is where TMS could be incredibly helpful. So hopefully this has been kind of a game changer, particularly if you know someone that has chronic pain. Again, I'm just sharing the information. Not everybody's going to be in the DMV area, the DC, Maryland, Virginia area, and going to come and get, 3 times a week for the first week, and then once a week for the next 3 weeks, treatment on a specific area of the body for pain, right? 6 treatments. But you're living in Timbuktu, or you're in Nigeria, or you're in Ghana, you're in Colorado, you're not coming to Maryland for my treatment. I get that. but there's TMS all over the world. Okay, not every single country has it, but it's growing. And so if you're somewhere in the United States and you want this treatment, go look it up. Look up TMS and chronic pain. And yes, we can consult and help, especially if your provider isn't used to doing this, and we can work with the provider and do trainings for the provider. But if you have access to good quality TMS and that person, that provider knows about using it for chronic pain, don't sleep on that. There's no reason that you should be in chronic debilitating pain when there are treatments out there that very likely it could literally change your life. It could change your world. At least until it's time for you to get your surgery, or at least until it's time for you to do whatever the next thing it is in your life. Okay? So, my prayer is that you will, now that you know this information, you have this information, that you'll govern yourself accordingly, or you'll share this information with a colleague that is, or family member or friend that's struggling in this way, so it will make a difference in their life. Okay? You have a very blessed day on purpose. Take care.